Hello, friends. Going live today on a special session which was told to me to take, especially on the last Facebook Live, how to manage your thyroid disease. And before starting that, I want to know how many of you all are popping a thyroid tablet in the morning time. So I want to know in that regard, how many of you all, as a routine, once you get up in the morning and take a thyroid tablet as a routine? Just let me know in the comment box whether it's yes or no. I'm Dr. Swapnil Nagwekar, founder of Dr. Swapnil's Health Arc, and I regularly post videos and go live session on various health issues. And today's topic is very vital in that sense that I'm covering a very important topic, how to manage your thyroid disease. And thyroid disease is very, very common among all individuals. And the severity is so much that there is around 200 million people worldwide affected by this thyroid problem. And if you see this issue, the females are affected more than males. So just hold on once again. The females are 10 times more vulnerable for the thyroid disease compared to males. So, and most of the people don't know that they have thyroid disease. About 60% of the people don't know that they have thyroid disease, which is at the subclinical level. So why this thyroid disease is very, very important topic. And the crucial topic, in this crucial topic, I'll be taking you what are the symptoms of thyroid disease, what are the blood tests you have to do, and 5 strategies how you manage your thyroid disease. Okay, so let's begin now. So first is, if you see the thyroid, it's one of the butterfly gland situated in the neck region. Okay, there's a very superficial gland in the neck region, and it secretes hormone T3 and T4. Now this T3 and T4 hormone is secreted when there's higher brain functioning, releases hormone which tell the thyroid gland to produce this hormone. So the first is the hypothalamus, which is situated in the brain, which stimulates the pituitary gland. ये पिट्यूटरी ग्लैंड जो हमारे ब्रेन में होता है, वहां पे वो सिक्रेट होके TSH रिलीज करता है. So that hormone is thyroid stimulating hormone. This thyroid stimulating hormone from the pituitary gland stimulate the thyroid gland to release T3 and T4 by means of thyroid peroxidase hormone enzyme. Now, what happens is T3 and T4, the T3 is the one hormone which gets absorbed in the cell, and T4 is freely circulating in the body. Now the question comes, why we have more of T4? See, T4 is freely circulating by means of thyroid globulin antibodies. And whenever there is a requirement of the thyroid in the body, the T4 gets converted into T3 hormones. And you remember that each and every cell of our body has some hormone receptors. But in case of each cell, there is universal receptor for thyroid and vitamin D. So each and every cell functioning of a body requires thyroid hormones, and that is very crucial. If you don't have thyroid, proper functioning of the thyroid gland, each and every part of the body gets affected, because thyroid gland helps in metabolism, it helps in digestive issues, it helps in bone maintenance, it helps in brain development. Basically, it covers a lot of functioning. The proper functioning of the thyroid gland is very, very vital for each and every individual. So as I told you, there are two hormones, T3 and T4. So now T4 is mostly stored in the body and it is protein bound. So the free hormone, it is the one which will get absorbed in the cells, that is T3. So now if you have more of bound proteins, then you will have hypothyroidism, because 99% of the thyroid is bound, but only 1% is released free hormones which gets absorbed. Now if the completely all thyroid hormones If it is bound, then you have prone for hypothyroidism. But if you have more of free thyroid hormones, you're prone for hyperthyroidism, means over functioning of the thyroid gland. Hypo means less functioning of the thyroid gland. So you have to know in this regard of this, in this regards of the thyroid functioning also. Now you should remember that the conversion of T4 to T3 is very important, because T3 is the one which gets absorbed, and for that you require good functioning liver, where 80% conversion occurs in the liver and 20% conversion occurs in the bowel. So these two organs are very, very crucial in regards to functioning of a thyroid hormone. So this is in short how the thyroid hormone works. So now we'll come to what are the symptoms of hypothyroidism. When you have mentioned the symptoms of hypothyroidism, the most common symptoms you will have is feeling of tiredness. You don't have much energy to work. The most you'll feel like lazy to work to anything. Sleepiness, this is one of the symptoms. Then second is weight gain. Unexpected weight gain is one of the crucial symptoms, because the thyroid hormone, the metabolism is reduced, and as a result you tend to put up more calories, and you'll get intend to gain of weight. Third is you will feeling of cold, because your metabolic rate is reduced, and as a result you will be feeling most of the time cold sensation. There will be pain in the muscles, in the joints at times. You're feeling a low mood, depression can be one of the symptoms of hypothyroidism. You can have a dry, itchy skin also. You can have an unexpected hair loss, because thyroid hormone is very crucial in formation of hair follicles. Then most of 17% of the people can suffer constipation because of hypothyroidism, and you can have menstrual irregularities like excessive menstrual bleeding can be one of the symptoms of this hypothyroidism. So you have see a long list of symptoms you can have because of this thyroid hormone, because each and every cell of our body requires proper functioning of the thyroid hormone. So thyroid hormone is formed by the absorption of iodine. The thyroid hormone absorbs iodine and it binds with the tyrosine and then forms the thyroid hormone. So this is how the thyroid hormone is formed. So this is the how the symptoms are there. Now which test you should do to know that your thyroid is functioning proper or no? So let me know in the comments that who all are suffering from thyroid disease. Let me know in the comment box yes if it is suffering from thyroid disease. If it is no, let me know in the comment box also you are not suffering from thyroid disease. Thyroid disease can run in the families. You can have an autoimmune component in that. Hashimoto's thyroiditis, Graves' disease, all this. This is one of the components. Then a deficiency of iodine is one of the deficiency of minerals can have because of these thyroid problems occurs. So which are the blood tests you have to do? You have to do the blood tests like TSH. TSH, the value of the TSH is 0.4 to 4.5 million international units. Then you have a T4 level. T4 levels varies from 5 to 12 nano microgram per deciliter. Then you have T3 levels, that is around 100 to 200 nanograms per deciliter. Now this is the three hormones you have to get checked, like TSH, T3 and T4. So on based on this you will be diagnosed whether you have hypothyroidism, you have hyperthyroidism, whether you're less functioning of the thyroid gland or you have more functioning of the thyroid gland. It based on this T blood test. Also, if you are suffering from thyroid, then you have to get your ultrasound done, because you have to check for the morphology of the organ. You have to check whether there are certain nodules, कुछ दाने वगैरह है उस thyroid hormone में. Then you have any cancerous lesion in the thyroid gland. If it is detected in the early stage, can be detected by ultrasound and can get a surgical removal of this. So definitely any thyroid patients get your thyroid scan done. That is very, very important. Okay, getting a thyroid scan done is very, very crucial. So now I'll be telling you what are the strategies, what are the valuable tips in managing your thyroid disease. So let me know in the comment box like who all are suffering from thyroid disease, whether you have an autoimmune component, if you're running in the families, let me know in the comment box also. So first thing is you have to replace your salt. How many of you all are using iodized salt in house? Let me know in the comment box. How many of you all are using iodized salt, refined salt, white salt, whatever you call? How many of you all are using? Let me know in the comment box. Okay, the most of the problems of this thyroid is because we are consuming excessive amount of refined salts, and this refined salt contains excessive amount of iodine, and the excessive amount of iodine, with that we the synthetic part and a lot of chemicals are added to it. So this excessive iodized salt or refined salt is causing problems. So you have to replace your iodized salt or refined salt with senda namak, or it is called rock salt. So you have to replace this refined salt with the rock salt, because rock salt has tremendous benefits and it has a good amount of iodine, not an excessive amount of iodine, because excessive amount of iodine causes a lot of thyroid problems, and the thyroid problems have recently increased after the use of refined salt. So try to replace your salt, table salt, whatever refined salt, with the senda namak, kala namak, Himalayan black salt, Himalayan rock salt, what you call. This is the best salt to have. If you want to know more information about it, just check out my video in Dr. Swapnil's Health, a YouTube video where I've told complete information about the rock salt, where you get a complete information as well as benefits of having this rock salt. So first thing is replace your salt, use rock salt. Second thing, you need to massage your thyroid glands. Now thyroid gland is very superficial gland, so just massaging over it, you can stimulate the thyroid gland because it helps in releasing thyroid hormones. So how we can do massaging of the thyroid gland? You can use 100% pure walnut oil and cold refined walnut oil, that is a crude oil which is called. If you take 4 or 5 drops in the night time and just massage over this area for about 5 minutes, it will help in increasing your circulation and it will help in increasing your release of thyroid hormones. So a lot of hypothyroid patients just have the massaging of this area with this walnut oil which I mentioned. If you can't get a walnut oil, what you can use is red onion. So you can cut the onion, and with the onion you do a massage over this thyroid gland, and also you can take out the juice, and juice you apply over the thyroid gland, apply it and keep it overnight, and in the morning you can wash out. So this onion, red onion, has a phosphoric acid which will benefit in the thyroid hormones. So it will be proper functioning of the thyroid gland. It will help you. So try massaging with this walnut oil or onion juice. You can also have salads. A lot of salads you can have. If you can have one time or raw, onions as a salad, that is also very beneficial. So externally you apply this onion juice. Internally you can take some onion, a salad. That is also very beneficial for your thyroid gland. So third, what is a valuable tip I want to give you is you can have coriander seed water. Now coriander seed water, the coriander, you have to grind it with mortar and pestle. You don't have to grind it in a mixer, because what happens is the heat in the mixer will remove the nutrients from the coriander seed. So you usually have to grind it in a mortar and a pestle. That is will be best thing for in case of a thyroid disease. So if you have a thyroid, just grind it with a mortar and pestle and store in a glass bottle. Now overnight, you can take 1 teaspoon, soak it in water and keep it overnight. In the morning time, what you can do is, once you get up in the fasting state, you can just boil it, okay, on a low flame. Just boil it, and the water content will reduce it. So it will, once it becomes half thing, the quantity becomes half, the nutrients will get dissolved in the water. You can strain it later on, and you can have this water in the early morning. And this early morning, see that you don't have your breakfast at least for 30 to 45 minutes after that. So you should keep a gap of at least 30 to 45 minutes after having the coriander seed water. Mind you, very, very effective, this coriander seed water. So what I've told you, replace your salt. Second, I've told you massaging with the oil. Third is you can trying to forget, massaging. Once you massage. And third, you can use a walnut oil. You can use a onion oil also, and also you can massage. You can coriander seed water you need to have. So this coriander seed water, it is very, very effective. You have to take it for at least for 3 months, and this 3 months you'll see the results. So massaging, and also the massaging part, and also coriander seed water, you have to take it together for at least 3 to 6 months. Very, very effective. Next part is you have to take the yoga and the pranayam part. So yoga and the pranayam section will be very, very useful, because what happens is this thyroid problem occurs because of your hypofunctioning. So there is a less blood supply at times. So you need to give a good blood supply to these thyroid organs, and you need to flush out the toxins. Mind you, thyroid disease doesn't happen in 1 or 2 days. It takes around years to develop the disease. So what you can do is you can just do proper yogic exercises and yogic pranayam. Now I'll tell you which are the yogic exercises you can do. You can do all these inverted poses. When you do inverted poses like leg raise, sarvangasana, halasan, you have the setu bandhasan, you have a head stand posture, sirsasan. All this, what will happen is increase your circulation in the thyroid gland. So what will happen once your circulation is increased, the toxins will be washed out from your gland. So once your toxins is washed out, you'll be proper functioning of the thyroid gland. So try doing this yogic exercise, and you can do around 15 minutes of yogic exercise. Now I'll be telling you the pranayams which are very, very helpful. The pranayam you can use, you can do is Brahmari pranayam, because a lot of times the stress and affect your thyroid gland. When there is too much of stress, the cortisol hormones prevent the conversion of T4 to T3, which I've told earlier. So as a result, the hypofunctioning of the brain also occurs, and then as a result, the thyroid stimulating hormone is not released. So what happens is you have to do this yogic exercise, you have to do this pranayama, which will be very helpful. And Brahmari pranayama will help you in releasing your stress. You just have to put the fingers in the ears, and you have to do a humming of a bee, and this will help you in relaxing your brain, and it will help you releasing your stress. Then you can do Kapalbhati also. You can help in washing out your toxins. Kapalbhati pranayam, very, very good. And the most useful pranayam which is there is the pranayam where you can Anulam Vilom is also very, very beneficial, where you get alternate nostril bleeding. You can take breath from one nostril and release from the other nostril. This is also very beneficial in releasing your stress. But the most beneficial is Ujjayi pranayam. So Ujjayi pranayam is especially beneficial for the thyroid gland. So what you do in Ujjayi pranayam is you take a deep breath and you constrict the throat. I'm just showing it. You can just put in Google and just find out how to do the Ujjayi pranayam. You constrict the throat and hold your breath in Jalandhar Bandh, and when you release from the left nostril. So this Ujjayi pranayam is one of the very, very important pranayams for thyroid gland. If you can spare 5 to 10 minutes on a daily basis, your thyroid functioning will be normal over the period of 3 to 6 months. So try doing this Ujjayi pranayam. Very, very important. Try doing this yogic exercise. This yogic exercise is basically what I've told is inverted poses. The concept is you have to increase the circulation to the thyroid gland, and Ujjayi pranayam will help you in functioning, the proper functioning of this gland. So because you are constricting the throat, so there is increased blood supply during that time. So try doing this Ujjayi pranayam. So yogic exercise around 15 minutes, pranayam around 5 to 10 minutes each, and that comes around 15 minutes. So 30 minutes of this pranayam, you will definitely get results within 3 to 6 months. You will be able to control your medications. You can reduce your dose, and over the period of time, you can also stop the medication. So depending on the state. So now if you're taking any medication, see that you don't stop any of your medication. Simultaneously, what I've told you, you can do this, and over the period of time, after 3 or 6 months, if you're regular in doing all these steps, definitely you will see results in your blood test. So try judiciously doing this, because without any break, and if you can be regular in your yogic exercise, regular in having coriander seed water, massaging, then definitely see benefits. The question comes is, what are the things we should avoid in case of a thyroid disease? Now, a lot of problems comes in case of goitrogens, like cruciferous vegetables, which you call cabbage, cauliflower, broccoli. Whether you should have or not have, there's a lot of question, a lot of confusion in this thing. The first thing is you can have this vegetable, but see that you don't have this vegetable raw. You should cook it. Once you cook it, you don't have any much problem, because the sulfur component of this food will get washed out. so it will not hamper your iodine absorption. So having cruciferous vegetables will not cause you much problem, provided you have it in a cooked form, not in a raw form. Once you have in a raw form, can affect your thyroid functioning. So get it cooked, that's okay, and minimal quantity on a daily basis is no issues in having this cruciferous vegetable. Thing is, to avoid is you have to avoid soy products, soy milk, all this tofu, and also you have to avoid those things, because that can hamper your thyroid functioning. If you are regular consuming too much of tea or coffee, like tannins, too much of caffeine, then you have to reduce it, because 1 cup of tea or coffee on a regular basis, daily basis is okay. But don't see that you don't consume excessive amount of tea and coffee, because that affects your thyroid functioning. Now I told you that conversion of T4 to T3 occurs in the liver. So you need to have an optimal functioning of the liver. If the liver is not properly functioning, if you have a fatty liver or any other diseases which affects the liver, your thyroid functioning gets affected. So you need to avoid all this fast foods. You need to avoid all this excess added sugars. You need to avoid all the salted foods which are there in fast food, excessive amount of meat which is there, which can have a terrible effect on your liver functioning, because the conversion, 80% conversion of a T4 to T3 occurs in the liver. And if you put a burden of excessive amount of foods, the liver functioning will get affected. Indirectly will affect your thyroid gland. So try avoiding these foods which will have a bad effect on your liver. Indirectly will be having a bad effect on the thyroid gland, because all these component added sugars, the diet cokes, all these contain sugars which will prone your liver, will hamper your liver functioning. Also, I've told you this. So these are the things you can do. So I'll clear the doubt. The cruciferous vegetables you can have on a regular basis, no problem, in a limited amount. But see that you don't have it in the raw form. You have it in a cooked form, so it will not create much problems for you. So that will be very useful for you. Now, so I'll repeat the 5 valuable tips which I've told you. So first is replace your salt. If you're using iodized salt, you need to change it to senda namak or rock salt. Very, because you don't require excessive amount of what do you call salt, iodized salt. You require minimal amount of iodized salt, and all these problems of thyroid has started after using this refined salt. Second is massaging with the apricot oil. Third is coriander seed water, yoga and pranayam, and this which foods to avoid you need to take. And one thing I will tell you, gut also plays an important role in thyroid functioning, because 20% of the conversion of T4 to T3 occurs in the gut. So if your gut is properly functioning, you need to have proper probiotic foods, yogurt, all these things will help you in better functioning of your gut. So you can take probiotic supplements also, because it will help you in healthy bacteria growth of a healthy bacteria, which will help you in proper functioning of the thyroid gland. So indirectly, should remember is thyroid gland is hormone, but there are 2 supplementary organs which are most important in functioning of the thyroid gland. So having a probiotic supplements, also it is said that selenium is required in the conversion of T4 to T3. So you need not take any selenium supplements. Just consuming 2 Brazil nuts on a daily basis is enough for you to get the adequate amount of selenium, which will help in conversion of T4 and T3. So this is my valuable tips which I've said in this regards, how to manage your thyroid disease. And mind you, thyroid disease, it is a problem over the period of time, just over the years. So if you want to reverse it, if you want to modify the dose, you can't do it in an immediate basis. You have to see that you follow this for 3 to 6 months, and can get testing yourself for the TSH, T3 and T4. And once you think your levels are getting down, better control, then you can think of reducing your thyroid dose, because suddenly reducing thyroid dose will have a bad effect on your body. So don't stop your medication on an immediate basis. Continue with the medication. Try this what are strategies, and over the period of 3 to 6 months, you will see the changes happening in your gland, also in your functioning. So keep this in mind. This is very important, because thyroid disease, it is definitely going to increase in future if you're not being cautious about this. And thyroid functioning can affect each and every cells of the body. So functioning of the thyroid gland becomes very important. So last time I was told to do a video on thyroid disease. So I am doing this video this time. So there was somebody who has told me also to do a video on varicose veins. So that is my next video which I'll be doing. Also, if you want me to do any other videos, let me know in the comment box. I can post later also. Let me know also which videos you want to do. I can do the videos, live sessions, or do a video YouTube videos, which will be very helpful for you. Okay, thanks for connecting with me, and thanks for patience listening. And I hope this is valuable tips. You will follow this, and it will definitely make a difference in your life. If you like this video, kindly share it with your friends. Okay, see that the thyroid disease can be we need not do a routine. We have seen people, even my mother, they consume in the morning. Once they get up, they consume, first thing they do is the thyroid tablets. This shouldn't be a routine. Consuming a tablet in the morning shouldn't be a routine. It's not a healthy practice. So let's see that this practice goes away, and we can go to holistic or what you call lifestyle changes modification, and definitely we can reduce the dose over the period of time. Okay, thanks for patience listening, and good night. God bless.